this little video series is called Dying Dar's Way, Radically Real Spiels on the End of Life. And I just realized that's a very German word.
Yes.
And I am sitting here with my German friend, Andrea Eberly, who is a medical doctor, specifically in emergency care. And Andrea has escorted or accompanied many people through their dying process and their death. And I'm excited. She's got a lot of very helpful things to say to me today. So
I must say
start.
that when I was a young physician, I could not understand how anybody could get into hospice care, palliative care, or cancer. But it is such a rich journey. It's amazing.
Mm-hmm.
And I've learned that from very dear friends in the past whom I have accompanied down through their last breath. And from that, I've learned some things I believe would be valuable to share that I did not learn in medical school.
And sharing is why
Yes.
we are here today.
Yes. And one of the things I've noticed that family around a person who has a life-limiting diagnosis of some sort struggles with how do we act or behave around this changing person.
Right.
And the changing person also struggles with that, but I've seen some repetitive patterns. And that is that as people lose their faculties, everybody has a need for love and for respect. But what is different between people, some people have a more overriding need for love than respect, and other people have more overriding need for respect than love, even though everybody needs both again. And the people who have an overriding need for love, they will give themselves into the sick role, essentially. And they're the ones who love their pillow fluffed, even though they're fully capable of fluffing it themselves. And who appreciate if you hold the door open for them or if you spoil them, essentially. And interestingly, they're the ones who are sometimes easier to take care of, not harder.
Because I would chop you off at the ankles.
And so would I. I am not that kind of person. I'm a respect person. The respect person needs to have room to retain their free will. And it's a very important concept. They need to retain room for the free will to even do things that people might think are not the best decision. They need room to take risks.
Right.
They need room to do things their own way. They don't need advice on if you were to do this, then you something better. That's taking away their free will. And this also applies to aging parents, where kids try to step in, how am I a parent to my parent? And for the vast majority of aging people, so we're changing away from cancer now, it's the wrong question. The vast majority of aging people want to retain room for their free will and the freedom to make bad decisions.
And so, for me, what's coming up is competence issues.
Yes.
I have a huge need around being allowed to live to my highest level of agency and competence, and people better get out of my way.
And if your competence has diminished,
Yes.
you don't want somebody stepping in, offering their competence for you to then reach a higher competence, because that conflicts with free will. And the specific thing I often tell family around somebody who's either aging or outright dying from a life-limiting disease is for them to set themselves free of a sense of responsibility. Oh my God, if only I had done this, then this wouldn't have happened. An accident, a fall, or whatever. Usually the person we're trying to take care of much rather have the fall, suffer the fall, and have lots of free will before that, and be able to live up to their own competence.
So we have to play hunches. We have to make some very targeted speculation about which, are we dealing with the love woman or the respect woman, because we could totally make the wrong call with the greatest good intention, go down the wrong route, and totally...
And people often do.
Yeah, it's an urgent time.
Yes.
Charged with adrenaline, right?
Yes.
So, any suggestions on how we can play our best hunch to determine how does this... I always use the words, let the dying person set the tone about how to be with them.
Yes.
how have you decided?
That, and also in the process, pre-forgive yourself for whatever is meant to happen. You're not responsible for the dying person's functioning, health, eating, anything. Just forgive yourself for what's going to happen.
Andrea hasn't heard this yet, but on my little anticipatory communicating cards that I have in a stack on my dining room table, which is also the hospital room, ready for people to come, my favorite message is, I believe love and forgiveness are time travelers. They
Yes.
are waiting in the future for you, because a lot of this is just the details. And we're human, we get a lot of the details wrong.
And we fear that we've somehow failed the person in their most humble moment. And the person who needs respect, we've not failed them in their most humble moment. It is one of the hardest things to allow a person to retain, competence and free will within their ability.
I am so lucky in the friends that I have who are doing this journey with me. Thank you, Andrea.
Thank you.